Hi, this is Dr. Bob Dannenhoffer, the Public Health Officer for Douglas County, with our update for August the 18th, 2022. Joining us today is our epidemiologist, Laura Turpen, and she's going to help us understand a little bit about better what's happening with Monkey Pox. But as always, we're going to start off with COVID. And the news with COVID is uniformly pretty good. Throughout the world, the number of cases are decreasing. We're not seeing a lot of disease in any one area, although there's still a fair amount of disease in Asia. But China, India, South Africa, and the rest of Africa not having very much disease. In the U.S., the amount of disease is decreasing with a decreasing rate of hospitalizations. Oregon is also seeing a decreasing amount of disease, a decreasing hospitalizations. And we're also seeing that in Douglas County. So I think we peaked last week, and this week has been quieter with fewer infections. We still have a moderate number of people in the hospital, and almost all of the people in the hospital are not up to date on their vaccines. Now, this is striking because about half of seniors are up to date on their vaccines, and yet when we look in the hospital, almost all of those people are people who have not had the disease before and have not been vaccinated. If you've either had the disease before, or you've had the vaccine, or if you've had both, then your risk of hospitalization and death is very low. And we continue to see some deaths, especially in people who got the disease for the first time and had never gotten vaccinated. So the word on that is please go ahead and get your vaccine. So I had 3 questions this week, and I think we'll get to them now. The first question was about the bivalent vaccine, and people wondered what a bivalent vaccine was. So a bivalent vaccine means that it has 2 different antigens in it. So the vaccines until this time have just had the antigen from the original virus that was isolated in January of 2020, and then that was in the vaccine. So all of the vaccines have that genetic code in it. We know, however, that over the time the vaccine is mutated, and now that most of the disease which is circulating is the Omicron BA.5. And so the FDA has recommended, and the drug companies will do it, where they'll make a vaccine which will work against both the ancestral strain, the original one, and also against the Omicron strain. And so we're expecting that to come out, and we're expecting that to come out in the next few weeks. However, the details of that, who's going to be eligible, when they're going to be eligible, when we're going to get it, that kind of stuff, we don't really know, but we're watching it very carefully and should be able to get that to you soon. The second question is, what about all the rebound we're hearing about? And in fact, we are starting to hear more and more of that. Maybe a quarter of the people who now have COVID, presumably have BA.5, are getting the disease. They're getting sick with symptoms, typically sore throat, headache, maybe not fever, achiness, sometimes cough. They're sick for 4 days and then they get better. And in fact, many of those people test negative. And then a week or so later, they start having symptoms again, and some of them even start testing positive again. Now, originally, we thought this was probably maybe had something to do with the Paxlovid, but now we're starting to see the same rebound in people who got Paxlovid and those who didn't. So probably not related to the Paxlovid, probably related to the BA.5. And so the BA.5 is the strain that's circulating now, and it may have more of a biphasic disease. That is, you get sick, you get better, you get sick again, and then you get better again. The advantage of that is people are not getting very sick during the second phase, where we're not seeing any hospitalizations for people who get sick on the rebound. However, they're still sick and they should still stay home. So for some people, it's doubled their isolation period. So they isolated for 5 days when they were initially sick. 10 days later, they're sick again, and isolate again for another 5 days. This is sort of what happened to the president. This is what happened to Dr. Fauci when he got it. So rebound is really one of the things. The third and last question we get is, when are you going to call this endemic? So a disease which is endemic is a disease which is in the population. It may not be in the entire world population, but it's sort of in a population, and it comes up and it goes down and you get some cases, then it goes away. And then a lot of diseases in the U.S. which are endemic. I think Lyme disease is around, certainly not epidemic. It's not causing huge disruptions. Pertussis we see occasionally, it's up and down. And that when a disease is endemic, it's up and down, but it's there in a population. It's not gone, but it's there in the population, but it's not causing major troubles. The question is COVID-19 now endemic? Well, to say that something is endemic, again, it should have minimal impact on society. We still have 15 people in the hospital with COVID, so that's not a minimal impact. And you can really tell that the disease is kind of stable in society only in retrospect. So it's so hard for me to predict what's going to happen a month or 2 months from now. We could have a dastardly new variant, in which case it clearly wouldn't be endemic, but we're certainly going in the right direction. So we've talked all along about being like the weatherman. We're really good at telling you what's going on today. We're pretty good at predicting the near future, but we are not particularly good at predicting the far future. So I would say at this time, the weather is improving in the world, in the US, in Oregon, and in Douglas County. And I would say there's no big storms on the horizon, but our ability to see too far out is pretty low. So otherwise, things are great. Our advice remains exactly the same as it's been for months now. Stay home if you're sick. We still know that many of the cases are being spread by people who are sick. So if you're sick, stay home. If you're sick, get tested. The antigen tests work pretty well, although not necessarily on the first day. So that if you test positive, then you've got COVID and you should stay home. You test negative, you should probably still stay home another day and test again the next day. The Paxlovid has been very effective at preventing hospitalizations. Even when high-risk groups have gotten sick, like in nursing homes and whatever, those have gotten Paxlovid and really avoided the hospital. So we really are still very supportive of using Paxlovid for high-risk people who get COVID. And then the vaccine really works. So we're really asking people to get the vaccine and to stay in touch about this bivalent vaccine, because I think the bivalent vaccine is going to be great, and it should be here within the next month or two. So as we're done with COVID, the question that's come up today is about monkeypox. And joining us today is Laura Turpen. Laura is a epidemiologist. Epidemiologists are people who track disease, and she is incredible at tracking disease. So she come to us from out of state, and she's just been a tremendous addition to our team. So Laura, welcome.
Thanks, Dr. Bob, and thanks for having me on today to talk about monkeypox. We have not had any cases of monkeypox yet in Douglas County. We have had a few in neighboring counties. So there's been 20 cases identified in Lane County and 1 case identified in Coos. So we know that it's a matter of time before we might see our first case here. In Oregon, total, there's been 116 cases. 112 of these have been in men, and 4 of them have been in women.
And so there was a case reported earlier in the week of a child, and we've seen that in the rest of the country. And usually these are children who live in a household of somebody who has the disease, showing that the disease is passed by close contact. And this close contact could be family contact. This close contact could certainly be sexual contact. But we've not seen any cases that are transmitted by distant contact, like getting it at the grocery store or getting it on the school bus or getting it in class. So I think we can be comfortable about that's not a big risk. But Laura, tell us about the groups that are seeing more disease.
So right now, folks who are most at risk for monkeypox are people who are having lots of close skin-to-skin contact. Right now, we're seeing the majority of cases are among men who have sex with men, so gay or bisexual men, or people who have sex with people in that group, like transgender women, non-binary folks. The sexual orientation and gender does not matter. Truly anyone can acquire this disease, including through just close household contact, not sexual contact. But this is the population in which we're seeing transmission right now. Similar to the beginning of COVID, we saw it spread in cruise ships. This is just the population of which this has spread so far.
Right. And it spreads just when you have close contact. So a great story about monkeypox is that monkeypox comes from Africa. And back in the last decade, there was a Gambian pouched rat that was imported into the U.S. as a pet. It then gave it to prairie dogs, and people then who handled prairie dogs were at risk for getting monkeypox. So it's really, you just have to have the contact. At this point, it's men have sex with men, but in the past, it's been animal lovers, family, people who live with people who have monkeypox. So we really shouldn't stigmatize anybody. It's just this group that's getting it now. But is there what can we do to stop the spread?
So I wanted to get on here today mostly to let people know that we do have the vaccine available here in Douglas County. It's the Jaundice vaccine. We've received very limited amounts of it so far, about 20 doses. But this vaccine is great because it can be used both as pre-exposure prophylaxis or preventatively, like the way most vaccines are. You get a dose and then you get a second dose some months later, and then you have protection. But this vaccine can also be given as post-exposure prophylaxis. So if I was exposed yesterday, if I got the vaccine today, that would dramatically reduce the chance that I would get symptoms. So if you think that if you have a partner or somebody who has tested positive for monkeypox or has symptoms of monkeypox, and you've recently come into contact with them, you can get this vaccine and it will decrease the chance of you getting it. If you get it within 4 days of exposure, you likely won't have any symptoms at all. But even if you get it up to 14 days after exposure, it will dramatically reduce the severity of your symptoms. And from what I've heard, this rash can be very uncomfortable. So we want to minimize that as much as we can for people living in Douglas County.
Great. Well, in the past, we've used post-exposure prophylaxis for other diseases like hepatitis A. So if you get exposed to hepatitis A and get the vaccine within a short time, you can actually prevent yourself from getting the infection. It also works with hepatitis B and chickenpox. So we know that post-exposure prophylaxis works. So if anybody's been in contact with somebody who they think has had monkeypox, please let us know, because we can go ahead and get you the vaccine. The other thing we would say is if you're in a high-risk group, you really should be thinking about getting the vaccine sooner. So, Laura, which are those groups that we're really focusing on?
Right now, we're focusing on a pretty narrow group. So just someone, for example, who takes public transportation, or a teacher, someone who comes into contact with the public. We don't have enough vaccine yet to start vaccinating those lower risk encounters. Some higher risk activities would be if you're having more than one partner, more than one male partner in particular, people engaging in transactional sex or survival sex, people who are having sexual contact at sex venues like bathhouses or bookstores, adult bookstores, or other locations. Sex is an activity in which there's a lot of close skin-to-skin contact, and so that's highest risk. Ways people can reduce their risk would include reducing the number of partners, or just having frank conversations with your partners about getting tested if you have symptoms, getting the vaccine. The vaccine's available, again, to folks 18 years of older. And any provider in Douglas County can do testing. So to be tested for monkeypox, you'll be seen by a provider who will use a Q-tip like swab, who will swab your rash and rub it on the outside and send it into a laboratory like LabCorp or Quest or the Oregon State Public Health Lab. And that's how you do the testing. So you can't be tested unless you have a rash.
Right. So you can't, do a nose swab or a throat swab. You actually have to have the rash to do it. Now, this is an unusual rash. I would say that no doctor in Douglas County has seen this rash ever before, but we do have ability to access those who have seen it. So if you do think you have it, go see your doctor, have them give us a call. We'll get some high quality pictures of the rash and send them to the experts at the state or at the CDC so we can help people make the diagnosis. And then the testing with the Q-tip is really very accurate. We can get preliminary results back in just a short time. The final results take a little longer, but we can do that. And And then the other advantage is that there actually is a treatment for this. So there's an antiviral drug, which is available, which we can get. Most people don't need it, but there are some high-risk people who may need it. So we're trying to get the information out. We've made a little infographic. Let's see if we can get that infographic up here. Oh, look at that. Well, you can see a full size of this on our website, but things you need to know about monkeypox. This can be spread with as many people as you want, because we want people to know about this. So again, monkeypox is out there. It's not something I would worry tremendously about, but if you're in the high-risk group or have symptoms, please, please, please let us know. Well, Laura, thanks for joining us.
Thanks so much, Dr. Bob.
Before. Thanks for joining us again, and we'll do this again next week. Again, this is Dr. Bob Dannenhoffer, the Public Health Officer for Douglas County. Thank you.